advising government accordingly. But again, is also wanting to say, make such a pronouncement is another thing if he has popular appeal, because a few days or weeks ago, the Lagos State government declared the fourth wave over. So which typically indicates that the COVID, as far as, even though we still have pockets of infections, 60-something per day, it was unlike what we had in December, 9,000 in a week. So it means that the epicenter of the COVID in Nigeria has significantly seen a massive reduction for it to be declared over. So, but that does not take away. So when we place this side by side with vaccine is meant to prevent or reduce the effect, the severity in the event you're because most people who had been vaccinated and they were exposed to Omicron, they were able to survive because they had taken the vaccine. But I think from a holistic perspective, the missing link is that there seems not to be quality attention given to our local realities, because COVID is a pandemic, but we have every day multiple cases of epidemics in a country where 160-something thousand people died of malaria in 2020. And we don't see any emergency response action that is involving stakeholders, public, private sector, social sector. It means that if you're talking to the average man on the street, he will, especially, okay, now having heard that from Lagos State government that this is over. So every other thing you're talking about, it will still look like a joke.
But what do you make of this, though? Because the point there is, declaring a wave over, the fourth wave over, of course, it's supposed to be sharing news to Nigerians or to Lagosians generally that the fourth wave is over. But the impact of that, when people feel, okay, it seems like COVID-19 is over, let's
party.
Exactly, let's go to party. You know, what do you make of that kind of impact in the minds of some people?
Again, I would look at it from a couple of angles. Number one is declaring it over, and there's still international traveling ongoing. People migrate to travel to Nigeria and vice versa. It's important that it should come conditionally, that this does not involve throwing away the non-pharmaceutical protocols. That rather we should even be vigilant so that nobody, make you sure your eye open so that nobody is caught.
Exactly. So we don't begin to get into the fifth wave.
Into the fifth wave. So that's one side. The other side is, can we now roll our sleeves? So the energy, the vigor, the collaboration that happened when COVID came, can we roll our sleeve to fix our health system? It will make the people here, the population, trust you. So are there potentials? I think on this platform I've spoken about medical intervention trust fund that ensures that Nigerians, less than 5% of Nigerians are actually on health insurance. So Nigerians who face daily horror associated with spending out of pocket, or of course, let me put it, lack of access to good Medicare, they can access that medical intervention trust fund. And I have actually recommended that COVID should take a lead on this. The way we have Lagos State Employment Trust Fund, Lagos State Security Trust Fund, that ensures you deploy vehicles. Securities. So we should have something like that for the health sector, especially for emergency. And it does not require rocket science that, okay, if we achieve XYZ mileage during COVID, let's deploy it. What are the key areas that take the lives of Nigerians? Sepsis, meningitis, malaria. How come Nigerians, out of every 5 children born in Nigeria, 20% don't see their 5th birthday? Are there things we can start doing? I mean, for my organization, we'll call it Project 1 Million, such that if we have 1 million people donate 1,000 naira per annum or per month, it ensures that more of the vulnerable will access care. So this is a time. So declaring it over is, okay, waking up to the other ills and flaws in the health sector and fix them.
That's being intentional.
Intentional.
Okay. All right. Now the point there is, some people have said that, well, comments COVID-19 has come to stay or is going to be here for a long period of time. Do you share the same opinion, though?
I read a press statement or an address from DG of WHO 2 days ago. And the way and manner he spoke points to the fact that we have not yet won the war. That there are likelihoods of mutations happening. The tragedy is that, and I like one particular word he used in his statement, that we are one species. What happens in China affects US. What happens in the US affects Nigeria and other parts of the world. But when, in terms of deploying solution, we are discriminatory, we do not come united. And that's what is hurting the world. Some of the cases we have currently, some of the epidemics I mentioned, they are not getting global support because they are maybe in Africa, they are in the third world. We need to really recognize that, okay, just in case COVID continues this way, how can we work closer as one species to fix the health system globally? We are not saying that the comfort the person in San Francisco enjoys must be the same with someone in Ajegule. But COVID does not suggest, because it's a virus, there could be more mutations, is to design a solution-driven approach. So if X, this best case scenario, this is the worst case scenario, and this is how we address it, this is how we did it with this. And also the other existing epidemics, how do we work together to reduce their
all right. I wonder how is, the attention has been shifted to COVID now in so many medical, in fact, across the world, and especially in Nigeria. You mentioned the issue of health system earlier on. Now, we still hear about tropical diseases, Lassa fever, polio. Now polio coming back in the mutant polio, leprosy, river blindness,
tropical diseases
like that. And the attention we would have been given to those all has shifted, or most of it has shifted to the COVID. In the long run, how is this thwarting the success or the prosperity that we all are supposed to enjoy as people?
So in so many areas, globalization has made it imperative that mankind ought to work together. But in reality, you see, okay, if you look at the wealth distribution in recent during and after COVID, fewer people have made more billions of dollars in terms of their wealth, and more people are now poorer. So if no sincere measure is taken collaboratively, we are seeing a very bleak health system, because the gains made prior to COVID, most of them have been erased. Resource allocations have declined. Even in Nigeria, where we have, if you check the statistics or the metrics, most of them in Nigeria is always taking I talked about malaria, that 70,000 people died of malaria in 2020, and out of that, Nigeria had a share of 27%. So if in Nigeria, we have not even seen that for the national allocation in national budget does not reflect it. It does not also reflect in the allocation in CSR of corporate organizations. You see more of reality-related programs, reality TV programs. Good for TV. But we are, the danger, there's existential threat. So I think that's the way to summarize it, that we face existential threat. More children, that if we have 20% of children who do not see their 5th birthday, we may see that number increase in the coming years. And the same may apply to road traffic, of course, road traffic accident and all these sort of tropical diseases. If no genuine, sincere measure is put in place, especially in resource allocation and intentionally planning, we may be facing existential threats.
Wow, it's okay. Pascal Achunine, Executive Director, Health Emergency Initiative. Thank you for talking to us this morning.
Thank you for having me.
Thank you very much. You're
welcome. Have a blessed February.
And you too. Thank you.